Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy you chose to spend this time with us as we will have a timely conversation. And without further ado, I'll turn it over to Dr. Randall Maxey, our founder.
Good afternoon, everyone. Thank you, Dr. Barbara Davis Stevens. Uh, Dr. Walsh, who I hear is under the weather, uh, Dr. Lawson, Dr. Hines, and I've asked Dr. Lisa Dawes from Jamaica to join us in our commentary, if she would. And we're celebrating the fact that we had a group of astronauts go to the moon and go around the moon and come back, which is a record-breaking trip. And what was especially nice about this, the pilot of the trip was a black gentleman, former jet pilot in the Air Force. There was a Canadian, the first woman, also, and another person. There were four astronauts in all. And we want to celebrate their safe return. But it was a very serious mission, and they did a lot of science and a lot of experiments were done. And they left some of their tissue here, and they're comparing it with the tissue when it comes back. So we want to talk about how this affects our health and what it is. Can we go with our first slides, Simon? Or any of our other co-moderators on, Dr. Lawson, Dr. Hines?
Not yet.
Okay. So the title of this is From Space to Our Streets. And this is about what Artemis actually is. It's a way of, I call it accelerated aging and how we can deal with that. Next slide. So what's happening? An astronaut returns to Earth unable to walk. Why is that? So even though our astronauts were able to walk, but they weren't allowed to drive for a few days till they get their act back together of what's going on in their middle ear. So there's extreme physiology that happens when you go in space, and that reveals hidden biology. So what happens in space is happening on Earth. Next slide. Dr. Barber?
All righty. So the core thesis today is that we will explore is one, accelerated aging is a shared biological pathway. Space is a compressed model of chronic disease. We can intervene early and change outcomes.
Next slide. So
Microgravity physiology. There's muscle unloading that leads to atrophy of the tissue or shrinking. There's bone resorption because of increased osteoclastic activity, which means that the amount of bone decreases. And there's cardiac deconditioning, which results in a decrease in the ability of the heart to push out the blood.
next slide. So there's radiation biology that's they're experimenting on too. We have ionizing radiation, which affects your DNA strand and breaks it, which can have problems. There's a substance called P53, which activates cell death. So you don't want to have bad cells around, so you want them to die. But if it gets unleashed, it can itself cause cancer itself. There's oxidative stress, which we've talked about before, which causes endothelial injury, and that's blood vessels all over the body. Next slide. Dr. Dawes, I know you're new with us, but would you look at this slide? Can you read it?
Sure, oxidative stress, reactive oxygen species, or ROS accumulation, mitochondrial dysfunction, and of course, cellular aging and damage, which occurs when we're in space.
So one of the things we're concentrating on is how the space trip is a way to accelerate aging, which we're undergoing because of our environment here on Earth. Next slide. That's
Endothelial dysfunction, which of course decreases nitric oxide, which help well and increases inflammation and vasoconstriction. So that's from two different causes. The decreased oxide actually does cause some vasoconstriction as well, but albuminuria as an early marker.
Thank you very much. Next slide. Dr. Neighbor Stevens.
So let's talk a little bit about what happens to our cardiovascular system. We have atherosclerosis development, which we've talked about, those plaques that can be disruptive to the endothelial lining and cause problems. Plaque rupture, which can lead to thrombosis or blockage of the vessels, and that can lead to myocardial infarction or heart attacks, as well as strokes, ischemic strokes.
Next slide, Simon. You want to read this, Dr. Neighbor Stevens?
So, cardiovascular risk versus age. So, in our 40s, we generally have about a 10% risk of cardiovascular issues. When we get to 50, that doubles to 20% risk. When we get to 60, it is triple from what it was at 40. And at 70, it's all the way up to 50% higher risk for cardiovascular issues.
Next slide. So hypertension disparities. You want to take this, Dr. Dawes?
I'm sure I'm just looking at it now. So for the white population, I think what's on the left side, 30% have hypertension. I'm not, and on the for Black people, roughly 45%, and Hispanics will have about 28% of them will be hypertensive. Is that correct? Am I reading the slide correctly?
Yes, you're doing well. Excellent.
Okay.
With the right accent too. Next slide. Dr. Neighbor Stevens.
Chronic kidney disease progression by ACR. When we look at the normal population, they have about a 5% accumulated risk of developing chronic kidney disease. When we look at when we have moderate
That's
CKD,
protein in the urine.
okay, protein in the urine, that risk increases, almost doubles. And as Dr. Maxey is always telling us about looking at that urine, if you've got that protein, a significant amount, you have a 50% chance of progression of your chronic kidney disease.
And the thing we
You want
should,
to clarify what ACR is for the public?
yeah, go ahead.
No, you go ahead.
It's called the albumin creatinine ratio. It's a
Right.
ratio of the amount of albumin that's in the urine divided by the creatinine in the urine multiplied by another number. And what it is a marker. But what's going on in the urine symbolizes what is going on in the brain, the heart, and every place else in the body. So it's a marker, but it's not just concerned with kidney disease. In fact, most people don't even die from kidney disease. They die from the problems in blood vessels in the brain, the heart, and the other parts of the body. Kidney disease itself does not kill people. It's just a good marker. Next slide. The renal system. So if you have glomerular injury, glomeruli are the little cells, not cells, but little organs inside the kidney. If they leak protein, that's called albuminuria. And it can progress to what's called chronic kidney disease. And I always talk about chronic kidney disease because it's a marker. People think the heart is so important, but the kidney may be a better marker than the heart. So there's microvascular disease, and this affects the blood vessels all over the body. Next line.
So, Dr. Maxey, you're saying kidney disease would therefore be a better marker for mortality rather than the heart?
Yes,
I'm
because,
just clarifying it, making it simpler.
well, okay, only because you can see it better. By the time you can see it in the heart, it's kind of late, but you can pick
Okay.
up an early marker. And you can look at it not only with the protein in the urine, but if you do certain types of MRIs, you can also pick up that very early. You want to take this to Dr. Neighbor Stevens?
All right, and Dr. Lawson has joined us as well. The
Let him do this one
neurologic
then.
system.
It has the word cognition in it.
You want him to take it?
Yeah, say he can spell the word cognitive decline better. Is he on? Is he unmuted? Go ahead, Dr. Neighbor Stevens.
Okay. We have microvascular ischemia, which means the very small vessels can be occluded or blocked. We have cognitive decline, and we have balance dysfunction, which is a function of the middle ear.
And my understanding is, and you guys can comment on it, that part of the problem that happens when you're in space, or if you have increased aging, your blood flow is different and it causes congestion in your head, your middle ear, and those things. And that affects how the middle ear functions. Can you clarify that, Dr. Lawson?
Yeah, no, I agree. One of the problems is that you just you simply do not have the normal distribution of blood flow to the brain that you do when you have gravity. And as a result, there's not only ischemia, but also not only balance dysfunction, but also differential effect on certain key organs like the hippocampus, which is very sensitive to um, real, real changes in real time.
Let me ask you a medical school question if I could. What is the difference in dizziness and vertigo? Is that in your wheelhouse?
Well, let me try that. This, of course, is related to a sensation in terms of when you had the feeling that of disorientation was vertical, related to the world spinning, related to the eyes going into the nystagmus.
All right, thank you very much. Next slide. Dr. Dawes, you want to take this one?
Endocrine system. So you'll have more insulin resistance, hyperinsulinemia. So you're producing more insulin, as well as the metabolic syndrome.
Next slide. You want to take this? That's Dawes.
Okay, space and insulin resistant. So with muscle loss, you reduce your insulin sensitivity, and therefore you get higher blood sugar levels and similar to sedentary lifestyle on the earth. So if you realize in space where you have more fluid going to the brain, there is your muscles work much less. That's your heart muscles, your regular muscles. So you have less muscles. And because of that, you have increased insulin or higher insulin levels, as well as reduced insulin sensitivity.
So the operant word there, and the important thing is don't be sedentary. You have to have exercise and movement. Next slide.
So follow up on that, we just said this, loss of muscle mass, changes in fat storage, as well as hormone imbalance.
Next slide. Dr. Neighbor Stevens.
The stress response in space. Isolation increases stress. Oh, I always trip on this. The pituitary axis overactivation and elevated cortisol levels just from the stress.
Next slide, I think is follow up on that one. Go ahead.
You hadn't changed yet.
Well, while you change, let me just note that you say isolation. Now we can say a lot more about that, but you're not really. It's not just isolation, but it's because many times we used on sending people in space alone, but it's isolation from just the ambient presence of other human beings, even though there are people around you.
Yeah, go ahead, Dr. Neighbor.
Cortisol and stress. The HPA axis, activation, hypothalamic, pituitary, adrenal axis. Cortisol rises, produces an increase in glucose, and cortisol and stress cause visceral fat, that's that middle of the body fat, to accumulate.
Next slide. Go ahead.
What is the HPA axis? Your body's stress control system. It connects brain, hormones, and adrenal glands. It helps you to respond to stress and illness.
Next slide.
How it works. The brain senses stress. It signals the pituitary gland. The adrenal glands release cortisol, which is also known as stress hormone.
Go ahead.
Cortisol, helpful but risky. Short term, it boosts energy and alertness. Long term, it raises blood pressure and can lead to weight gain and increased diabetes risk.
Next slide. Dr.
Stress effects, constant cortisol elevation, insulin resistance, inflammation, and a weakened immune system.
It's funny how all these things sort of interrelate. Interesting. Next slide. Dr. Dawes.
Lessons for Earth. Movement is essential. Stress must be controlled. Hormonal balance protects health. Yes, we all tend to be aware, but I'm aware of this, but trying to get in our exercise and controlling our stress sometimes can be difficult, but I guess much worse in stress.
Yeah. What are some of the things we need to do to control stress?
Meditation, mindfulness, exercise, both aerobic as well as lifting weights, all have been shown to help with stress. Controlling how we respond to stress. Good sleep. So getting in our sleep or the correct amount of sleep for us, which can be a little different for each person, and deep, good sleep. Also eating the proper foods with supplements.
Yeah. I think I need to spend some time in Jamaica, get rid of my stress.
You're more than welcome. We should have a meeting in Jamaica. I keep saying I'd be happy to set up one.
Okay.
Dr. Max, I just want to note that we have a lot of data now, both from people spending time in Antarctica, as well as some of our longer trips. And the important about it is that sure there's dealing with short-term stress, but chronic isolation, chronic separation from other human beings produce the same kind of effects as putting someone in solitary confinement for weeks or months at a time. And that's a different kind of stress that the usual strategies don't work. And so you need to develop strategies to manage, and people who are in chronic isolation too, manage cognitive tasks, more complex tasks in terms of telling stories in the head and so forth. So it's not just simple mindfulness or going into transcendental meditation. You need to really go into additional training to be able to manage it in terms of object-related, task-oriented tasks.
Okay, next slide. Thank you. That's Neighbor Stevens.
The immune system in space. There is a weakened immune response in space. There is more inflammation going on, and there's slower healing and an increase in infection risk.
Take the next slide too. I think we'll go a little bit further.
Health disparities. Higher hypertension prevalence, earlier chronic kidney disease onset, and increased mortality rates.
Next slide. Dr. Lawson.
Environment influences biology. That's a very, very important issue. Environment does influence biology. Just want to note again, all of us evolved in a situation in which we're exposed to gravity throughout their lives. So this is a unique environment. Access, nutrition, and as noted, stress. And again, I just want to emphasize stress is not just stress, but stress can be the stress from psychological stress, but also the stress from having constant expectation of disaster. This happens when one does not have immediate availability of rescue operations. And then chronic exposure accelerates aging, and I think we talked last time about the problem of people of our Earth environment in terms of exposing chronic exposure to stress, but also there not only you have the chronic exposure to stress, but you also have the effects of radiation as well as the effect of an environment in which you literally do not have a way to respond to crises or disasters that you do when you're in near Earth environment.
I think if I lived in Jamaica, I'd live longer.
I think we have stresses everywhere, but we do have nicer fruit and more fresh fruit and vegetables, which is helpful.
Next slide. So our clinical strategy should be to have early detection, such as the albumin-creatinine ratio, blood pressure, and lipids. We know that the new guidelines that came out on lipids recently talk about trying to get everybody who's at increased risk to LDL of 55 or less. So if you're walking around with an LDL of 100, 125, 150, or even 70, you want to try to get that as low as possible because that's a major risk factor. We also talk about blood pressure, and I've talked with a very close relative of mine who thought that their blood pressure was 125, 130 over 80. It was good. But you learn from doing chronic disease management, the lower that pressure is under 120 over 80, it cuts down your risk statistically. And that urine test, the ACR, albumin creatinine ratio, is very important in picking it up as early as you can because that does mean that you may have blood vessel disease throughout your body. And then you should have aggressive intervention. Not, and we talk about stacking medication, not just let's try this for a few months and add something on and something else. Let's do all the treatments at once and get a lesser side effect profile from 2 or 3 medications that do the same thing. Don't just take a statin, but add the other drugs to help get rid of that. Is zinamide and the PK9 drugs all at once. They help to get that number less than 55. And also, the modern drugs that we have now for weight loss, people think that's what they're all for. But the SGLT2s, things like Farxiga, GLP-1, such as Ozempic, those also cut your risk very extremely when you have, especially if you have CKD or protein in your urine. But I think people will find that they have a good effect even if you haven't gotten the protein in your urine yet. But that is the cost factor we need to think about. Next slide. That's Neighbor Stevens.
Lifestyle interventions that we need to pursue. Exercise helps to restore the normal physiology. Healthy eating helps to reduce inflammation, and sleep helps to regulate hormones.
Next slide.
Dr. Max, just want to note the sleep part again. Sleep is not just sleep. We know now that you got to have some amount of REM sleep as well as slow wave sleep. There are people who do very well on very little sleep because they go right into REM and can have sleep needs taken care of in a couple of hours. Or people who can have intermittent sleep rather than chronic sleep. And then again, just note human beings up until maybe a couple thousand years ago um, did not sleep continuously through the night. So when the light bulb was invented and stuff, that we changed our sleeping pattern.
So let me ask you a question, doctor. One, explain what REM sleep is, and what happens if you do have chronic kidney disease and get up 3 or 4 times at night to pee.
Yeah, REM sleep, of course, is rapid eye movement sleep, in which we now know that the brain sleep is not a reduced activity of the brain, but that but that's in certain times of the night, the brain is actually more active as much as when you are awake, and that's related to the sleep that we see in REM sleep. You see, you don't see just synchronized delta waves, but you also see more complex patterns as well. And in REM sleep, the neuroendocrine system changes so that if you do not get sufficient amounts, you can have chronic, you start producing the stress hormones in levels that you do not do when you can have regulatory sleep as it should be.
So REM sleep is good then.
REM sleep is good if you get it on a regular basis. And but there are pathological conditions associated with REM sleep. For instance, people of color have an increased risk of a phenomenon called um, in which we tend to show sleep patterns consistent with REM just before we wake up, so-called witch's ride and witch's brew and so forth. The long-term consequences of this, I don't think anyone's really understands yet.
Okay, when do you dream?
Well, that's a good question. You think that REM sleep was dream sleep because your eyes were moving like you were awake. But the fact of the matter is that some people have very little REM sleep. They still have dreaming, but the dream is more task oriented, um, doing work, walking down the road, something like that. In REM sleep, dreams can be more dramatic. And then, of course, we have some pathological conditions in which the dreaming can be more catastrophic, more like nightmares. So dream can occur in almost any of the stages of the sleep except deep emergent sleep. But the REM sleep is more related to the kind of dreams that we have more that we remember and have color and vision and so forth.
All right, next slide. Thank you, Doc. Dr. Dawes.
Speculative origins. Human dependence on gravity. So living on the Earth, we have to deal with gravity, and when you go out on space, they have much less gravity, which affects our muscles, our brains, our heart, everything, even our immune system. Radiation sensitivity, which Dr. Maxey mentioned, and evolutionary adaptation to Earth, as we were talking about with the gravity or sunlight.
Next slide. Dr. Neighbor Stevens.
Actions needed. We are reversing accelerated aging. Health equity is essential. Acting early saves lives.
I think that's the last line. Last line.
Nope, one more.
Go ahead, Dr. Davidson.
Well, this is your opening thought. An astronaut returns to Earth unable to walk. Extreme physiology reveals hidden biology. What happens in space is happening on Earth.
I think that's the last next line.
That's it.
Thank you. So, are there any things and any thoughts or questions in the chat?
Yeah, there was a question about the ACR. So, what are the numbers that we need to know?
Okay, ACR, if you want your numbers to definitely be below 30. But any amount of protein in urine is a sign. So you may have 5 milligrams, you may have an ACR of 10, 15 milligrams, but once it gets to 30, that's a recommended time that you should have the SGLT2 drugs and the MRA drugs to stop you from having protein. But looking at patients like I have, when you have any protein more than 1 or 2 uh, milligrams of protein in urine, it's something to be concerned about. So you're so-called safer if it's below 30. But I think if you have any amount over 2 or 3 milligrams, it's pathological. And we should change our medicine like that. Make sure you get your advice of your provider on that and read up on it. Did I answer your question? Who asked that question? Have any more follow up on that?
That was Miss Hall, and she has another question.
Okay.
Her next question is, this came when we were talking about stress. How about chronic exposure to the news media?
That affects the HPA. that that is something. And if you know that the one thing that this current government does, they make sure that every 5 minutes there's something in the news about what atrocity they're doing in the world. And it's to keep you confused and keep stressed up. So I think that's purposeful to put people off balance. And it's very smart. People think that this man is dumb. He ain't dumb. He's smart and keeping everybody off balance. Any other thoughts on that?
Dr. Maxey, yeah, I just want to note that it's been well demonstrated that discussions around homicide, suicide, actually increase the rates of these kinds of events right at the point in which it appears in the news. So in our community, when we broadcast stories about suicide or even homicide, and it's documented in the past that in the old days, it used to be that homicide perpetrators, if they were African American, were much likely to be shown in the news, whereas if they were victims, they often were not shown in the news. So that had an impact in terms of now how people perceive crime, so that crime becomes a lot more stressful than it needs to be, because the narrative is often that the homicides is a result of people from outside or from African Americans. And it's well demonstrated that when folks see the perpetrators as African American or mentally ill, it's much more stressful to communities.
I think Daddy Bush, when he was running for president, had a character that he demonized as being responsible for all the crime and stuff.
That's
So you're
right.
very right on that. Any other thoughts? So I think that what we do, that stress goes up, the cortisol goes up, it messes with your lifestyle, gives you visceral fat, and it's a problem. It's a very big problem.
Very, and yeah, especially with the elderly now, the social isolation um has caused more stress and depression. And has actually, I can say, especially with my mom with COVID, and of course she was elderly, so people couldn't visit her. And I definitely think that helped her to die because she didn't die from COVID. She just went. But I think that was the only time she felt a little lonely because of her age. People wouldn't visit her, and she got lonely. People were afraid of getting her sick. And the elderly now, a lot of them are living on their own. And as you talk about, we need other people to help us decrease our stress, being around other people, and a lot of them are not getting that.
Very, very good.
Yeah, let me just add to that. There's this idea that social media can replace normal human interaction. And we're now finding more and more evidence that social media, for many people, is actually more isolating than
Yes,
actual face-to-face interpersonal contact. And that can be extremely destructive for some communities. So we're now is now an active effort to see how can you work with social media to make it so that it helps reduce isolation and avoid the problems that happen when you have social media alone. So there is a way to do it. There's technology is being developed, but then you run into other problems where people actually begin to start prefer social media over human interaction.
And that brings up Dr. Neighbor Stevens. I've got several young grandkids, and their parents are very concerned about screen time. And then there's this character named Elmo. Can you talk a minute about how screen time and media affects young kids?
Well, I was going to bring that up as a matter of fact. Any parent can go to the American Academy of Pediatrics website, and there's a lot of information there about screen time, which basically under the age of 2, there's no need for. But at the end of the day, sometimes I think it's the parents that have the issue more than the child, in that the parent is either afraid or doesn't want to deal with the lack of screen time and what that requires of them, in terms of what needs to be done with their child. Let me quickly say, this is not a new issue. This exact same issue came up when television came out.
That's right.
And so, we keep repeating the same song, different chorus, but same song. At the end of the day, the children need human interaction. There are all kinds of studies that show, even going back to intrauterine interaction is meaningful and helpful. So,
Explain
they
that
sh-
for a minute.
what
Yeah.
talking to your baby, singing to your baby, and responding to your baby. Um, there are plenty of studies that have shown that when either the mother or the father speaks, the baby's heart rate goes up. It's not a soundproof area. So inside the uterus. So what they're worried about the screen time? Well, to me, it's not anything to worry about. You just don't do it.
Good luck
Well,
on that one.
thank you. Thank you.
you
Well,
know, I went out to a dinner with a bunch of my kids' friends. It was a whole bunch. And I was looking at the table while we were eating. It was, at a restaurant. 80% of the people sitting at the table were looking at their phones and typing on their phones rather than talking to each other. So much so that I commented, and then we all said everybody's phones have to be put away for a while. But we commonly do this. And the young people know, I don't know, you could probably give me more statistics on this, but I know in Jamaica, we are seeing more depression and anxiety in our young than we have ever seen. I don't know if it's because we're picking it up more, but our hospitals, our clinic are busier than ever. And this was going on before COVID, so I can't really blame it on COVID.
Yeah, please, those who haven't had a chance to read my book, Beyond the Pandemic, where I make exactly that same argument. COVID helped recognize that the rates of depression and anxiety is increasing in our country, especially for African Americans. But it was already going on. And
Yes.
to a large extent, a result of institutional racism, which is being attempts to discount its impact in terms of our lonely society. So you got a two-edged sword. On one hand, there's a concerted political effort to reduce the importance of institutional racism, historical racism, and these factors for our young people. But on the other hand, the reality is that they're trying to survive in a world in which these kinds of adverse circumstances and stresses are impacting their lives. And it's been reinforced, but unfortunately, by social media, which again is an attempt to carry that same narrative, and that is that if you things like drugs of abuse some of this social gaming sites purportedly was designed to reduce stress, but in fact increase it in our young people.
Thank you so much. Well, we're almost at the top of the hour, and I want to thank everybody for joining us today on this beautiful Sunday afternoon. Let's go with final comments. Dr. Lisa Dawes, final thoughts.
Final thoughts was that I had been procrastinating my exercise, and with everything that's said, I think we all need to go do a little exercise to make sure we get it in today.
Very good. Dr. Lawson?
I just want to note that I'm very glad you brought this issue up. What is we got to look at the importance of this message of the role of astronauts because it's also a strong political message. John Kennedy recognized this. It became a very important issue. Initially, astronauts were invariably white male. There were a couple of black ones, but they're mostly white males. The message was that the US, North America, Western culture is producing this ability to go to the moon. In fact, we contribute just as much, Dr. Johnson and others, in terms of what we're doing in space. So I really do want to encourage us to learn more about this. At some point, those of us who read science fiction are aware that when we start colonizing other planets, probably we'll be among the first to go out there. And the long-term consequences of that, spending long periods of time on another body and so forth, is becoming a source of concern and issues. And it's not, and again, it relates not just to loneliness, but also to the perception that you not only have other people around you, but you do not have the ability to interact people and opportunities when you need to, or to have the kind of support that you can call upon when you have even social media. Again, if you go to another planet, that's just not a very viable option for our current technology for another couple of years.
Thank you very much. That's Neighbor Stevens.
Well, I will confess that when I first saw the topic to be discussed today, I was a little put off because I went back, my mind went back to many, many years ago when my late son was about 5, and we walked out the back door one summer night, and he looked up in the sky and he said to me, "Mommy, I'm going to go to the moon." And I said to him, in all seriousness, that if that's what he wants to do, I support him all the way, but Mommy's not coming. And I think that there are a lot of reasons why some of us who are more mature have those reasons, superstition, science fiction, all kinds of stuff that contribute to that, and just plain old fear contribute to that attitude. But here we are on the brink of, really on the brink of colonizing, because that's the goal.
Mhm.
and we need to pay attention to what's going on.
Thank you very much. So
Point.
my takeaway from this subject was that I felt very impressed and proud of especially the Black astronaut, who was a former jet pilot in the Air Force. He's very articulate and probably did a lot of the verbal expressions of how good it was to have the teamwork they had. But even before that, many of you may remember that in sub-Saharan Africa, there's a tribe that people consider very,
Yes, sir.
and this tribe was called the Dogon tribe.
Right.
And they had a worship relationship with a star, and they called it a triple star.
Mhm.
And this star was thought by all the white people at one point to be not a triple star. But in 1964, U.S. scientists at Palomar discovered, in fact, it was a triple star.
Right.
The Sirius star. But more importantly, we had a slide in here about speculation about human origins. One of the things that was discovered in the caves that these prehistoric Black people lived in sub-Saharan Africa, that they had drawn the nearby solar star system, not solar system, star systems, and accurate to a fault, that they knew about this. So somebody said, well, maybe some space people landed one time and taught these ignorant Black folks what was out there. But my point has always been, maybe these so-called primitive Black folks were actually stranded here, and they were actually the space travelers themselves. I prefer that thought, that maybe we, being the first people on Earth, were from space as well. And I'm not trying to be religious, but there's more to this than we know about at this point and can really do. But thank you very much for being with us. Thanks very much, Dr. Dawes, for participating with us. Thank you, Dr. Lawson. Thank you, Dr. Neighbor and thank you, Simon. And we're praying today for our co-moderators who are not with us because of illness. Thank you, everybody. Have a great Sunday.
Bye.
Amen.
Yeah.
Right.